So, good morning, everybody. And I'm going to give you a little update quickly on COVID-19 and where we're at. So, what we said, we're at the peak of it right now. Our numbers show it. We've said this time and time again. We talked about, wearing a mask, staying 6 feet apart, coughing in your arms, all the good stuff. We know the drill. Unfortunately, it's been almost 2 years, and I know no one wants to hear about it anymore. I know everyone's tired. They're just beyond it. But unfortunately, with the new variant that's out, it's not beyond us. So just want to give a quick update. We had another Albany County resident pass away, a woman in her 50s. So my condolences and prayers go to the family. Since the outbreak, that brings us up to 468 people that have passed away. There were 245 new COVID infections yesterday. Another thing, as you've seen, people are doing differently with EPI, with the mapping and tracing. It's been changing. We've learned a lot from a year ago versus today. So we kind of changed things in Albany County. You can go to our website. You can look at the web page. You can find out, if you got COVID-19, you know it. You go there. You can look at it. It gives you a quarantine. We know where you need to be if you have it, how long you have to quarantine for, who you've been exposed to, and we're asking you to roll up your sleeves and help us out. Because again, these type of numbers are hard to keep up with, and I want to thank Dr. Whalen and her team, who've been at it for almost 2 years. We didn't think we'd be sitting here, and it's been a long 2 years for everybody. There's 5 new hospitalizations. 60 county residents are currently in the hospital. So there are still 8 COVID patients in the ICU, and as of yesterday, that was 78.5% of Albany County's population. 71, this is a good number, 71.3% have been fully vaccinated. We're getting there. The vaccine continues to change the whole course of this whole thing with hospitalizations. So I do want to give you some numbers. I know people read the numbers all the time. You go to the state website, you go to ours, and we've said this for the last 21 months. Not everything catches up at the same time. There's 62 counties in the state of New York. There's a lot of hospitals. I can't even begin to tell you how many are in this great state of New York. So the data sometimes lags a little bit, So the number on the state might be different than the number we're reporting because the state didn't catch up to us. So it's nothing new. And I know people keep commenting and keep wanting to know why. The numbers are different, and we explain it all the time. I wish we were all on the same sheet of music, but in technology world, as things, we get it, we put it out, and then the state has to catch up. So out of the 63 county residents who were hospitalized, 27% were fully vaccinated, and 63% that were in the hospital were not vaccinated. 63% of our residents in the hospital. 63% have not received a single shot. We always said the vaccine doesn't stop you from getting it. The vaccine just hopefully stops you from dying or ending up in the hospital or the ICU. So if you look at the numbers across the nation, I can't keep saying this, and I say it time and time again, you got to believe what you want to believe. Please look at it. And all I can say is that you saw the former President Trump and Biden saying good things about the vaccine, getting it out there. So, so the people that say one thing, just go on there. It's not fake news. It's a reality. They both compliment each other on getting the vaccine and encouraging people to get the vaccine. And that's the only way we're going to get out of this. So of the people that passed away so far for the month of December, 66% were unvaccinated. 66% out of the 18 people. 33% were fully vaccinated, but had underlying conditions, and I can't get into all that. But from December 1st to December 23rd, we had 22 Albany County residents pass away. Only 18 of them were counting. Again, you'll see the difference in the numbers in the state, and I'm just pointing that out because we do continue to get that question all the time. So the numbers are off for the state and the county, and there was a total of 22 people, but out of that, 66%. So the vaccine works. That's all we kept saying. That's all we continue to say. Everyone sitting at this dais, every mayor, Mayor Sheen, Mayor Patricelli, everyone just says the same thing. It helps. Compare this to this last year. We now have 4,123 new infections, 160 new hospitalizations. So just keep that in mind. So, again, with the new variant, I'm just saying to everyone, please do the right thing. You know what you have to do, and respect people. If they want to wear their mask, respect that. If they don't want to wear their mask, respect that. Don't get in arguments with people in restaurants. If you don't like what you see, just don't go in. Just don't go in. You know, I know the TU did a good story on restaurants that you have to be fully vaccinated, ones that you don't. You know, choose where you want to go and eat and where you feel safe and comfortable. I'm saying to everyone here now, please, please don't get in arguments. It's the holidays. Enjoy the holidays. Move forward. And just respect one another, because this has been a mental health issue as much as it has been for opiates, as much as it's been for the COVID-19 that we've been into. So I do want to switch gears because there's some really great news going on. And I can't thank my partners, because it does take partners. And I especially want to thank Governor Hochul. I want to thank Commissioner Bray from Homeland Security for making a lot of this possible. The governor has seen that we need to get masks out there. Testing kits have been a big issue. So I do want to say thank you to everyone and to the partners, and to Sheriff Apple and his team, who runs a great EOC that gets stuff out, delivered. You know, when we talked to the Homeland Security Commissioner, and we talked to the governor's people and the governor, and we were like, you get it, the supply, we're going to get it out. And we're here to tell people we are going to get it out. There's 138,000 KN95 masks that will be going out to every town, city, and village in Albany County. As we're speaking now, it's being delivered. Also, the home kits, we're putting them out. They're free. We know it's been an issue to get these kits. We know it's been hard if you go to Walgreens or CVS or different places, and I believe it's $25 to get two tests. There's two testing products in each box, and I know it's been an issue. So we're putting out almost 10,000 of these. We broke it up. Sheriff Apple will get into the breakup of how it works out. It's based on population. It's based on how we're going to distribute it. But again, these boxes that we have here, we had at our Department of Health, and it was for school districts. And with school districts going out early and being on break, we made the request. I want to thank Dan Lynch and my team. On my floor, we worked with Homeland Security Commissioner. We worked with the governor's people, and we said, can we get them out? And the governor was like, absolutely, get them out. We don't want them sitting around. We want to get them to people that need them, especially with the holiday. And I know people are panicking. And look, this is just the first shipment of 10,000 going out. By the end of the month, we'll have more. So be patient with us. But it's good that we're getting what we have out because, of the issue. I know Governor Hochul has announced we're going to get 5 million more testing kits by the end of the month. So that's the goal, is to continue to push these out, get them to people in need, especially in the black and brown community, where it is expensive to get testing. And it's fallen into, you saw the governor announce yesterday that the new testing protocols to keep kids in school, that's the goal here. And that's a thing that Dr. Whalen and her team been working on with the commissioners, or I shouldn't say commissioners, superintendents of the schools, in Albany County, and I can't thank her enough for doing that. But I do want to turn it over to Sheriff Apple to talk about it. Thank you for your partnership. He's getting this delivered very quickly, efficiently, effectively, and the partnership's been unbelievable these last 22 months. And I do want to say thank you. I know it's been a long haul, but to your men and women of your department, thank you.
Thanks, Dan. So the 140,000 masks that got delivered, 9 pallets. We've had a meeting earlier today with the emergency managers as well. It's going on a population ratio to break it down. Obviously, the city of Albany being the largest, they receive 33,000 masks plus. And, all the way down to the town of Westerlo, that'll get 1,000 masks. So it's just, I know people will say, well, my gosh, that's just a drop in the bucket. But these are KN95s. They're very good masks, much better than the cloth mask. You've seen some of the testing and things that go on with the cloth mask versus even a surgical mask, and this is a step up from that. And there's only a minor difference, believe it or not, between the N95 that you see your medical staff wearing versus the KN95. So early this morning, our staff started to load up our trailers. As we're sitting here now, the masks are being delivered with the assistance of the mayors and the town supervisors. Everybody will have the masks. That's it for our involvement at that point. what I'm saying is that we have then turned it over to the emergency managers and the municipal leaders to decide where and when to drop. We wanted to get them out, so hopefully this weekend people can start to disseminate the masks and try to quell the spike that's been going on in the Capital District. So as part of that, with County Executive McCoy, we then scrambled quick because they got the testing kits, and we've added the testing kits as well. So there's a ratio breakdown per population as well for that. Even though that only represents a small amount of the population, the test kits are going out as well. So again, you can call us and we can steer you to whomever in whichever town is dealing with that, but there's not much that I'll be able to do as far as the actual dissemination. We're disseminating to the towns as I sit here, and that should be done within an hour to 2 hours tops. And so again, I appreciate the state's assistance. They've always been great. And kudos to both our teams actually for, we got this late yesterday afternoon and it's already out, so it's a good jump.
Thank you, Sheriff, as always. And again, it can't happen without the mayors, without the supervisors working with us. And I know it's right before a holiday weekend, right before Christmas. Most places are closed tomorrow, but yet still everyone's rolling up their sleeves. Mayor Sheen, thank you so much. Mayor Pazzelli, thank you so much. I don't know if you want to say anything.
Thank you.
Thank you. I don't mean to put you on the spot, but I do want to say thank you for your partnership. On another good note, as we know, the FDA authorized the first COVID treatment pill, which is good. Which once we start getting that in, we'll get that rolling out. And if you take it, as you've seen on the news, it stops all the symptoms of getting really sick and ended up in the hospital. So another tool in the arsenal that we'll be able to utilize going forward. And I just want to remind people, if you got your vaccine shots more than 6 months ago, you're up for a booster, please go get your booster. I know you don't want to hear that. I know people are like, I'm done, I got my 2. Please, just now's not the time. Now's the time to roll that sleeve back up. You did it twice. We're actually going to do it a third time to get through this spike we're going to see. We're going to see a big spike going up, and then hopefully it goes back down, and then we have to readjust how we're going to fight this going forward. So I do want to remind everyone of that. So I also want to thank the sheriff working with us yesterday at Department of Health with the booster shots. It was a huge success. He's been doing this too with the drive-through, going out to other parts of the county, working with all of us in this. And they did a total of 195 total vaccines, 177 booster shots were given, 11 shots for 12 and over, 7 shots for under 12. And to your team and to the Department of Health, thank you so much for getting this done. Highly appreciate it. And again, I do want to remind everyone, we have broken this down with the boxes that are going out. And I know you're probably calling Mayor Sheen's office right now, Mayor Pazzelli and everyone else. Give them time too to try to break it down. And there's parts of the community, like Mayor Sheen was saying earlier on a Zoom call, that she already has it broken down, that really need to get to certain people in the area that really need these testing kits. And we want people to gather, have a safe and healthy holiday in Christmas, and but do it safely. And please be careful. And Dr. Whalen, I don't know if you want to add about the EPI and everything else that we're doing in the direction we're going into.
Sure. Thank you, and hello, everybody. So as the county executive has indicated, we are now starting to see a rise in cases, and I think that this is likely due to the Omicron variant, which is present in increasing proportion in the United States. It is estimated by the CDC that currently about 70+% of cases are Omicron, and this number is expected to increase. If we look at how this is played out in other countries, the rise in cases is very rapid. The trajectory of the upward curve is very steep. It is very unfortunate that we find ourselves in this situation on the week between Christmas and New Year's. But it is where we find ourselves. So we know that there is this highly transmissible variant, and it's starting to reflect in our case numbers, which have been above 200 for several days now, and this morning's poll looks like it will be higher again today. So I do want to continue to stress caution around behaviors, social distancing, wearing masks, and limiting family gatherings to those that are fully vaccinated, and trying to limit numbers. It is not the advice that I had hoped to be giving this Christmas season, but it is the advice that I feel is responsible to provide at this stage. What we're hearing from countries that have had this surge is that the surge peaks very quickly. And in South Africa, it was reported this morning that the cases are starting to dissipate just as quickly as they started to pick up. So this is somewhat encouraging, but what we want to do and what we're always really focused on doing is protecting our hospitals and protecting against unnecessary severe illness and death. And really the cornerstone for protection does remain vaccination. So if you have not been vaccinated, please get vaccinated. We do have, vaccine is safe and it is widely available. If you are vaccinated, fully vaccinated and boosted, your chances of going to the hospital if you contract COVID-19 and having serious outcomes decrease on the order of 30 times. So it is a very effective protective measure for all family members that are eligible for the vaccine. So that's everybody now from age 5 and up. And for those over 16, you can now get a booster if it has been 6 months since your last mRNA vaccine, which is Pfizer and Moderna, or 2 months since J&J. I do want to mention that if you received the J&J vaccine, new information from the CDC now has stated that it is preferred that you be boosted with an mRNA vaccine, COVID. Those are Pfizer and Moderna. The reason for this is that there is an extremely rare but quite serious side effect that could occur with J&J. Now, if you're a person that has received J&J, you should know that this is very rare. I have a daughter who received J&J. It is only a concern for the first 30 days after you receive the vaccine, and it is fine for you to go ahead and get the Pfizer and the Moderna afterwards. If you are a person that has a contraindication, we encourage you to discuss with your physician. In some situations, the J&J can be offered for the booster. We do have supplies of all three at the health department. So I continue to stress the importance of vaccination for everyone. And, the masks are important as well. We know that masks reduce transmission and offer protection for those that wear them. So when you are indoors and gathering, or if you are in an indoor environment, if you are Christmas shopping, if you are grocery shopping or out and about, the mask can still offer protection against transmission. And we similarly continue to advocate for people to wash their hands, and staying home when you are not feeling well and getting tested is important. These tests that are going to be disseminated today are rapid antigen tests. The tests are very effective, and if you are symptomatic, they should detect coronavirus. They are easy to perform.
Again, everyone, thank you, and thank you for our partners, Mayor Sheen, Mayor Pasali, as always, and Sheriff Apple, and everyone else out there. Thank you. I know Christmas is in 2 days. Please enjoy your family. Do the right thing. New Year's is in 8 days. So again, please do the right stuff. We'll get through this. Again, I want to say thank you to Governor Hochul for her leadership on this, and to the Commissioner of Homeland Security for helping us get this stuff out.